Hello guys, welcome once again to my channel. The name remains Dr. Brown, and today the topic for the day is congenital adrenal hyperplasia. This is a fairly common topic we encounter in medical practice. We also see it a lot appearing in the USMLE exam. That is if you're studying for the USMLE exams. It's even common in most medical exams you would take. So I'm looking forward to discussing this and trying to find ways we can remember the presentation. Okay, so congenital adrenal hyperplasia is usually caused by 21-hydroxylase deficiency, which is the main enzyme involved in causing this particular condition. But it can also be caused by 17-hydroxylase deficiency as well as 11-hydroxylase deficiency. Okay, so this particular condition can, as you can see, can be caused by 3 different enzyme deficiencies. Okay, but one thing to note is that each of these enzyme deficiency will present with a particular phenotypic trait, okay, which will help you to differentiate between the various causes. Okay, in regards to this, you need to pay attention to the numbers. Okay, so 21, 17, and 11. Where is the 1 appearing? If the 1 appears in front, for example, in 17 and 11, okay, then it means that there's going to be hypertension. Okay, if 1 is at the end, which you can see in 21 and again in 11, it means that there's going to be what we call ambiguous genitalia, which will be as a result of high testosterone, okay, being produced. So again, you ask yourself, where is the 1 located? So in 21, the 1 is at the end, so it means there will be ambiguous genitalia. In 17 hydroxylase deficiency, where's the 1 located in front? So it means there will be hypertension. In 11 hydroxylase, there's 1 in front, there's 1 at the back, so it means it will present with hypertension and ambiguous genitalia. And it's important to note that the ambiguous genitalia, due to the high testosterone, will be seen in females with this condition. And male, because naturally males have high testosterone, you won't see the ambiguous genitalia in a male. But in a female, because they have estrogen, and in this particular condition, their testosterone levels will be increased higher than what it would be in a normal female, then they would manifest with the ambiguous genitalia. Okay, the clitoris would going to be enlarged and whatnot. Okay, so it's very, very important to know this. Let's just say we'll call it easy trick to recall this various enzyme deficiencies. Okay, so again, note where the 1 is appearing. Is it in front or is it at the back? So 21, 17, and 11. Okay, these are the common enzyme deficiencies. Okay, so now we'll jump into the various components of the cortex. This can be remembered as GFR, so glomerulosa, fasciculata, and reticularis. Okay, the reticularis produces androgens, and then the fasciculata is where cortisol or corticosterone is produced, and then glomerulosa is where mineralocorticosteroids is produced. And this can be remembered as GM, okay, which is good morning. Okay, so that tells you that the glomerulosa is responsible for producing mineralocorticosteroids. Okay, so these are the various components of the cortex, okay, of the adrenal gland, okay, and what they produce. Now the medulla is also involved in production of epinephrine and norepinephrine. Epinephrine 80% and norepinephrine 20%. So epinephrine is more produced than norepinephrine in the medulla, and this can be recalled by in medulla. You notice that after the M there's an E, so it tells me that the medulla produces more of the epinephrine than the norepinephrine. Okay, it's very, very important to note this. So cortisol deficiency may appear or may present with hypertension and hypoglycemia. Cortisol deficiency would be seen in congenital adrenal insufficiencies. This condition, there will be high eosinophilia, and then there will be an increase in ADH production. So this can be remembered as 2H, and then there will be 2L, which is too low. Okay, and then that will be low BP, hypertension, or low sugar, which is hypoglycemia. Okay, so it's very important to note that adrenal insufficiency is like the opposite of congenital adrenal hyperplasia. Okay, which in congenital adrenal hyperplasia, there will be an increase in BP and an increase in sugar or hyperglycemia, whilst eosinophilia or the eosinophil count, and then the ADH secretion will be low. Okay, so it's very important to note this difference between congenital adrenal hyperplasia as well as adrenal insufficiency, also known as Addison's disease. Okay, knowing this basics would help you to answer lots of questions in regards to endocrinology when you are talking about adrenal gland. So this is all I have for you today. I was hoping to make it 5 minutes, but I think it's a bit longer than 5. Thank you for watching, and do not forget to like, comment, and subscribe.